Without basic sanitation. The situation, according to WaterAid, is intolerable and demands action. Country representative of WaterAid Ghana, Dr. Afia Zakiya said this after ministers from Ghana and nearly 50 other countries pledged to strengthen efforts to bring water, basic toilet facilities and hygiene to their people following the Sanitation and Water for All high-level meeting in Washington, D.C., USA. She said though WaterAid welcomes government's commitment at the high-level meeting to provide safe water and sanitation, what is crucial now will be concrete actions to deliver those promises and to act upon previous pledges. Country Direct Representative of WaterAid Ghana, Dr. Afia Zakiya, joins us on the line for more. Good afternoon, madam. Thanks for joining us.
Good afternoon, Nancy. Thank you for having me.
It is said that a child dies every minute and over 3,600 children in Ghana under 5 years die each year of diarrheal diseases. This is because they do not have access to water, sanitation, hygiene. Can you elaborate on this for us?
Yes. One of the things that is very apparent is that WASH and the access and provision of clean, safe water, sanitation, and hygiene underpins human health. Child nutrition, child well-being is linked to the provision of safe water, sanitation, and hygiene. In fact, in Ghana, the number that we gave in our press release is actually quite low. In a study that we recently did, we found out that about 10,000 infants die, actually, by the age of 5. From diarrhea alone, and this is attributed to poor sanitation and hygiene. So alongside this issue of diarrhea, we have public health issues with HIV, AIDS, tuberculosis, and malaria. And one of these diseases alone kills more young children each year than all three combined, and that is the diarrhea problem that I just mentioned. And all of these are linked to having safe access to water, sanitation, and hygiene. So we really have a problem. When we look at our schools, no matter the age of the young child, when we look at health clinics, many of these facilities do not have the proper facilities, toilets, wash bowls, and then even sometimes water running. So what we try to do in WaterAid, of course, through our school wash program, is to try to address some of these issues by providing some of the facilities. But we think that it's really government's responsibility to address these issues. We're only here supporting.
Doc, I was coming to that because you have welcomed government's commitment, but you said that there's a need for concrete actions for those promises to be fulfilled. What are the actions that should be taken?
Well, first of all, there's an apparent gap in financing. So we need more financial commitment to the wash sector. According to the promises by Ghana, the government of Ghana, we're supposed to provide at least 0.5% of GDP towards the wash sector, and we don't. I think we have been averaging around 0.2 to 0.3% over the last 3 or 4 years. We also need to have behavior change. Once I think government actors recognize the link between wash, health, economic well-being of the population, we hope that this will spark them through political will to do the proper allocations of the budget and allow the budget, the funding to actually reach the communities through the District Assembly Common Fund, but also to be transparent about what is there, what is being budgeted for, and how much is really actually being spent. We think that there's also a need for government to look at taking a more sector-wide approach in the wash sector. They are doing this in the health and education sector better, where because of the large dependency on donor funds, there is better coordination and tracking even of the spending of funds once they do come to those particular sectors. So we need to have something similar to that happening in the wash sector. I think another thing that can be done is that we begin to look at more performance-based contracts by both government officials being responsible for wash delivery, as well as politicians. I think some of the concrete actions that need to take are not just on the government side, but also on the public side, that we need civil society and we need communities to hold government and political officials accountable for some of these promises that they're making. And if they don't deliver, they shouldn't be in office.
If we allow this to continue, I think that we'll be losing the future generation. 3,600 children dying each year. I want to know what we haven't done right all these years.
Well, that's a big question. What we haven't done right. I think we need to coordinate, again, different sectors, because the issue of public health is beyond just the water, sanitation, and hygiene sector. We need the health sector. We need the education sector. We need all of these actors coming together to see the synergy and how they can work together to address the issue of sanitation. I think we also need to look at how and where the WASH funding is going, who is benefiting. We have an issue of inequality. We have the rural-urban divide, and then we have, of course, regional disparities, where some areas have larger coverage than others. And I think we need to begin to address these issues across the board in Ghana. What are we not doing right? I think we're also not looking at what is happening now in the sector, where there's economic benefit to taking care and addressing the sanitation issue. We have technology options such as biogas and biofuel, where we can, and ecological sanitation, where we can transform waste to energy. And these are some options, I think, that save lives, that also can generate income for communities. And we need to do more in those areas.
Doc, we are indeed grateful for your time. She's Dr. Afia Zakiya, the country representative of WaterAid Ghana. Time for business now, and Sena Numo is here. Good afternoon, Sena.
Good afternoon, Nancy, in business. The Ghana